Welcome everybody to Hyperbaric Plus. We're having our next week's event, and we got a special guest today. We actually have two. This right here is Adam Payne.
Yes.
And he's kind of known for having too many balls in the air, so he's not here yet.
He does a lot.
So I'm Paul with Hyperbaric Plus, and we have a guest today. This is Dr. Dalia Westmoreland.
Darla.
I'm sorry?
That's my doctor name.
That's your, okay, so I'm sorry.
That's
So
okay.
go ahead
That's
and
my license.
introduce yourself and tell us what
There we go.
why you're interested in being here. Before we start, Keith, I'm sorry, I jumped right. So excuse us, we're doing a whole new deal today. Keith Bishop, Prevail Over Cancer. Keith and I do this every week, and we've got a lot of people that are following us and asking questions. But we've always been talking about having an oncologist to work with that maybe thinks outside the box.
Mhm.
And so all of a sudden, we got introduced to Dalia, and she says, it's not Doctor, it's Dalia.
Yes.
We got introduced to Dalia, and she's out of Tulsa. And Josh couldn't be here today, so he's usually with us. But Keith, let's go back. Why is there an interest in having an oncologist that thinks outside the box?
So it's very important. So with people needing that help, that individualized treatment, and so everybody's going through the standard of care, and the standard of care is not addressing the underlying causes. It's a treatment, and the doctors are trying to do the best that they can. As you know, they're doing the best that they can with what they know.
And what they're forced into.
And a lot of times with the association with the hospitals, clinics that they're with, they have to follow a protocol, and to even, a lot of times our protocol is insurance based too. This is what they can do. And so what's nice is practitioners, like actually I sold my pharmacy to go into natural type of things and to get out of that practice because I couldn't do that in the pharmacy. And the doctors were upset. Pharmacy board kept having to come talk to me. And so I said, I'm just going to get out of that. And so I could start doing the natural things. So so it's nice to have a practitioner that is willing to look at and first of all, notice that things aren't ideal and willing to step outside that bound. That's a challenge to do that, to step outside the traditional medical system. And so I'm excited to learn about Dalia, about what she's doing. And so I'm going to just pass the mic over. So tell us about why you're changing gears and what you do. And so you're in Tulsa, Oklahoma. And so tell us a little bit more. I'll pass the mic over.
To be fair, you met me as Dalia Westmoreland,
Okay.
which is my married name. And my husband and I have been doing holistic medicine, body, mind, spirit medicine together. He was a pastor and a social worker, and we opened that practice in 2003. Restoring More is the name of that. We
In Tulsa?
in Tulsa,
Okay.
actually Jinx.
Okay.
Well, our first office was downtown Tulsa, and then we moved to Jinx, where we lived. And I did body, mind, and he did mind, spirit, so we overlapped that way. My doctor name is Darla, and I've used that since I got licensed, but Westmoreland was my church name and social. Okay. I've been interested in this for decades, and I liked psychoneuroimmunology a long time ago, and it ramped up really in 2020 when COVID came, and I saw that, as you say, the doctors were all forced to follow protocols set out by their specific institution, which was a hospital usually. There are hardly any individual practices these days with doctors.
Right.
It's too expensive, and there's a lot of throughput that goes with the institutions. You don't have time to spend with patients. And Bill and I always wanted to spend time with our patients. So we did our own thing in the office. But during COVID, the pharmacists would not fill my prescriptions. and they were told that that I could lose my license and lose my boards. I'm board certified in internal medicine and medical oncology. That bothered me. The FDA sent out letters to us telling us that we were doing things that were inappropriate. But this has long been so that doctors can prescribe anything off-label that they want to. That's
So a
what-
lot of people used to call that practicing medicine.
Yes, practicing medicine.
Me too.
Couldn't practice it here.
Good practice. So this is a great opportunity for me. I found out a lot about red light during COVID and its value, and hyperbaric as well. One of my former students has a practice dealing with wound care, and she was able to get boarded on her own by training with other people around the country, and she has a hyperbaric chamber there in Tulsa that she's well respected, well known. So I've been interested in that.
Good, so why don't you, because one of the things that caught my eye, and you haven't, I've got
Oh,
one.
we've got one.
So one of the things that caught my eye that we haven't got to dive into was your credentials, because you're retired.
I'm retired from OU, University of Oklahoma, Tulsa, and I'm retired from the VA.
So here is Adam Payne, and he has blessed us with his presence today.
Sorry to be late.
Adam, Dalia, we had a conversation yesterday, so this is Dalia. So we were just getting her credentials. You came from the VA, you're retired from the
I'm
VA.
retired from both those institutions.
So was it the one in Muskogee?
I was chief of staff there
Okay,
and chief of medicine first, and then also involved in the Tulsa outpatient clinic. And I did oncology for the VA and for the University of Oklahoma, Tulsa. That's my oncology background.
so we started talking, and Adam, why don't you introduce, because you've never been on our podcast, I don't think, but
No.
so
Hi.
so Adam Payne is the owner of Ultra Botanica, and I got pulled into this whole group of people through Keith. I think you and I met through Gwen Lipper.
Yep.
And then that went out to Keith, and then Josh from Tulsa, and then Joe Tippins is involved with this group, and so that turned into a roundtable discussion. And so all I try to do is connect all these people. That's all I do. I don't have any credentials. I'm just a guy that, I go diving every day.
You have passion.
We got a dive shop.
You have a lot of passion, and you have your own life.
I know that we had a conversation, you kind of drove the boat yesterday. What is your excitement about having an oncologist retired that has an open mind? What does
Well,
that bring to everything?
you know, the science of oncology is a tried and true science that was built through decades of very difficult years, starting in the 50s, when, mustard gas was the first, drug that was proposed. And it really was driven by leukemia in children, because it is the most tragic disease in mankind when you have these little children that get afflicted by this disease. And there was nothing that was working, but mustard gas actually was reversing disease in kids at an early stage, but then they would stop responding. And so oncologists really lived through some very difficult years in forging cytotoxic compounds where they essentially were afflicting these kids with poisons with the hope of bringing them into remission. And it was through decades of very difficult work that we were able to, oncologists were able to come up with the therapies, combination therapies really,
Absolutely.
that were able to turn leukemia around in these kids. And that was the foundation of oncology. The oncology sciences essentially brought forth with very difficult training, where the hope is early on the affliction of pain and suffering would bring about remission. It's only recently that we're essentially an understanding is moving from a gene defect driving the sciences from the 70s on. Now we're coming back to an Otto Warburg approach to cancer, which is the godfather of a metabolic approach to cancer, where we're starting to, I think, now see fundamental changes in oncology as a science, and I'm grateful that you're here. It's very rare to see an actual a hardcore oncology practitioner to come into an integrative approach to cancer.
Thank you, I'm so glad to be here. Over the last couple of years, I've noticed that inflammation seems to be the bottom line for many diseases, cardiovascular diseases, including cancer. So I'm very happy that we're working to prevent inflammation at its root causes. And a lot of the things that are happening here in your world are designed to do that.
And, you know, Ultra Botanica as a company, we have our roots in, we learned how to make curcumin bioavailable. You know, as a compound, curcumin is probably one of the most, it should be the frontline therapy for all diseases of inflammation, because as a molecule, it's a perfect match an intracellular network called NF-kappa beta. And NF-kappa beta, if you take the analogy of this complex, it's the gas pedal of inflammation inside of a cell. The more the NF-kappa beta is activated, essentially the faster inflammation signaling is being transduced through the cell and into the local environment. And the more that we could inhibit NF-kappa beta, essentially the lower the inflammatory signal goes into the local tissues. So curcumin, if you can get it into the cell, is kind of like the perfect molecule for modulating inflammation. And I was lucky enough to, and with God's blessing, I believe, to find a strategy that enabled the absorption of curcumin through something we call protosorb, or we used to call it liquid protein scaffolding. But essentially, we're using protein as a prodrug. We're piggybacking off of the benefits of protein and helping to absorb curcumin into the body. And Keith, as a retired pharmacist, I mean, you've known that curcumin has been, should be like a force to be reckoned with.
You know, for everything, inflammation, you know, thank you. Yeah. Inflammation is a driver for everything. Yeah. And so whenever you go to the medical journals and you can look up, you know, NF-kappa B, IL-6, and the different interleukins and many different messengers involved, but all the different types of health issues. I've taken curcumin also for years for inflammation and joint issues and hips, and it does make a difference, you know. And matter of fact, and if you make enough changes, things can get better. And so I used to test positive for rheumatoid arthritis, but I've made enough changes, my gut health, and taking curcumin, I'm negative now. And as long as I do everything right, I don't have any problems. But I can, you know, start eating inappropriately, and within a week I start having some weird immune reactions. So therefore I'm pretty motivated, so it's pretty easy to do. As a matter of fact, we were talking about in the hyperbaric, we're not supposed to call it a dive, because we don't really go in the water. We go into the high pressure, and we're talking about other options besides bread. You know, we don't have to have bread. You know, we don't have to be eating wheat and white potatoes and rice. There's definitely other foods, you know, that we can eat and still get enough calories as long as we're absorbing it. So, but yes, inflammation is a major driving factor, and I'm always looking at those markers, you know, in that. As a matter of fact, even white blood cell counts of monocytes and neutrophils being elevated above the lymphocytes. That's another indicator of some inflammation going on that people don't feel it, but you can see that showing up in some lab works.
Now, I want to share something with Dalia real quick. No, go ahead. I'm mic'd up. So one of the things, everybody that signs up for hyperbarics, I gotta say 50% of the people that says, why are you looking at hyperbarics? For inflammation. So when they come in, I specifically have a conversation with them. Are you familiar with curcumin? Oh yeah, I'm on curcumin. Do you do it with black pepper? Oh, absolutely. If black pepper makes it bioavailable. I said, well, then you don't know anything. You need to learn about protein. It used to be proteins captain. Liquid protein. Yeah.
Protosorb, yeah.
So now Protosorb. And I need to put a big banner up here that says, do you know what Protosorb is? But when they don't know anything other than black pepper, they're an easy target. I mean, they can be brought along so much quicker. And every time they buy some of your product, they're like, well, why haven't I been doing this the whole time? Because there's no other products out there that have that absorption capability. So anyway, I just wanted to throw that out there.
Just recently, I don't remember which board it was, but 2 boards that make guidelines for practicing physicians recommend testing routinely the high sensitivity C-reactive protein to measure inflammation. Do you know the boards that did that?
No.
Okay. I can
It's
find
good,
out.
they should.
They
Yeah,
should.
Definitely.
C-reactive
Yeah.
protein is a great biomarker for inflammation.
Yes.
Right.
Yeah, and we see regularly with our curcumin that CRP does go down clinically, which is just, testament to the fact that you can make curcumin work if you have the right formulation to get it into the body. But what excites me more is, getting to know you, Dalia, and talking about your experience and your work. We're learning as we delve into a metabolic approach to cancer that it's how important diet, nutrition, and understanding all of the different things that a person can do metabolically to help them on their own cancer journey. Maybe you could address some
For
of
their
those
own
factors.
health journey.
Or their own health journey, yeah. Myself included, my wife and I got the implantable CGMs, that can do real-time glucose monitoring. Oh my gosh, I've been like pre-diabetic and didn't even know it. And I've been like living healthy and eating what I thought was right. But without knowledge, we can sometimes just be entering into territory that we're completely unaware of.
Knowledge is power.
Yeah, it can be, if we use it.
What
Assess, don't guess.
Yeah.
assess, don't guess. I
That's
like
That's
that.
Keith's motto.
Oh,
That's good.
Assess,
super
don't
motto.
guess.
Perfect. One of the things that impressed me so much about our Zoom call yesterday with Adam is that I learned that the Oklahoma Medical Research Foundation approached him as a scientist, which gives him great credibility in the minds of all physicians, because that institution has been part of our lives. Anybody that went to medical school in Oklahoma knows of that. So congratulations.
Well, yeah, we've had quite a history here in Oklahoma, and we're still, Ultra Botanica, this month, we're 10 years old. So we're going to be celebrating our 10-year anniversary. Everybody, you should come and join us on the 18th of October over at our headquarters facility. We're going to have some celebration, some free t-shirts and stuff like that. But the fact that we've been here for 10 years and contributed to the health and wellness at so many different levels is just, it's astonishing.
So I got an invite from Shy.
Awesome.
She's doing a podcast tomorrow, so we all want to come over and be involved.
Adam
But
has a
I know there's not, I've been in that podcast room, there ain't in a room. But anyway, what a neat deal. How do we promote that Shy's gonna do a deal with Joe Tippins?
tomorrow, isn't it?
Tomorrow?
With
Yeah.
Joe Tippins.
I know.
A lot of people that I know at my church are on that protocol that he put out for various things.
Yeah, he's quite a guy. I mean, he's such a humble man, and he's gotten no compensation for any of the work that he's done for the last 7 years at promoting, just essentially telling his story. He's not even promoting a protocol as much as just telling people, this is what I did,
There's hope.
and this was my journey, and the fact that he became cancer-free just on his journey is astonishing, and we're seeing hundreds of people achieve the same results by mimicking the same kinds of things that Joe did. It's truly a great, he was a great, what do you call, trailblazer.
Trailblazer.
Yeah.
Yeah. So, by the way, shall we let people send in a few questions?
Okay,
Yeah,
answer
so,
some questions.
by the way, so, we're on both, Facebook, you're doing Facebook, on Hyperbaric Plus, and then Prevail Over Cancer. And so if you have questions, go ahead and submit those as a comment, and Ryan's going to help, print that off for us, and so we can answer a few questions as we get close to the end of this.
So Ryan got us on a platform that we're on Instagram and Rumble. I mean, we're on several
Several things
social
at the
media
same
platforms at one
All
time.
right,
That's
good.
And
phenomenal.
he wants to talk to you about
Okay.
that, so I think it'd be very beneficial for you to hit all of them at
Yeah,
once.
that sounds good.
Do we have any questions? So do you have a question for Dalia? I mean, I know you guys, maybe there's some things that's hard to talk about until we have a little pre-conversation. Because, until RFK Jr. came out with his little spill right before the election, it made all of us gun shy, very much so gun shy. But we're hearing that there's really loosening up all those strangleholds that the alternative medical components have been dealing with.
But there are definitely some changes going on, and in the news today, I saw that the nation, if not maybe the world's largest retailer, is actually making a change in their foods,
Oh, yeah.
and
Absolutely.
they're not going,
Walmart.
they're taking out the is it artificial colors and ingredients and things like that in their private label brand. So Walmart's making a change.
Good for them.
And so, but part of that's actually because of people learning. So, seminars, social media, sharing the concerns about what's in the food, and then people reading the labels, assessing, and then making changes, and if it's a financial change.
So one place, and I don't know how much we've talked, I know Adam probably hadn't heard this, but I've got some clients that, and I'm dying to visit with you about this. I've got clients that are in renal failure. And when they get in here, they're bringing their labs. We identify where they're at in their labs. A couple of them have worked with, I've got about 4 people lined up to work with Keith, because I want him assessing their labs as we make changes. But I've got a gal she was headed to dialysis 2.5 years ago. And she stopped in our office and I talked her into diving, and she pushed off her dialysis, and she's now pushed it off for 2.5 years.
Wow.
And today, her numbers are better than the day she started 2.5 years ago. So now, all that being, if you look at the numbers and extrapolate the numbers of what it costs for dialysis over 2.5 years, and the fact that she spends 3 one-hour sessions in the chamber per week, that's a difference in $225,000. The best, the smoke and mirrors, I can't even find the numbers. I'm just going with the very lowest number that it could possibly be, which is $400 a session for 2.5 years to do dialysis. That's $225,000 that her insurance has not had to pay. She's paid $18,000 doing something that's not recognized. So when is the public going to start pushing back and saying, look, I have insurance for a reason. I chose not to do it your way, which would have cost an extreme amount of money and my health. Wouldn't have done my health any good. So I need to be reimbursed for what I've paid to save you all $225,000. When do we start getting reimbursed? When we can show data.
Exactly.
I'm not trying to go and say, look, I've got an idea, I'm gonna go do hyperbarics for my kidney issues. Well, nobody expects that to be pre-approved. And even if you tried to get it pre-approved, it's a denial. But if you can show data over 2.5 years, why can we not get reimbursed for that?
Right now, they're all anecdotal. So
Mhm,
you
right.
have a case, I have a case, and we need to collect data and write it up.
But
and
it's,
present it.
He's doing that. Yeah, he is doing that too.
yeah, we're doing,
He's
I've got
collecting the
people's
data.
labs, I've got a line chart, I got.
So the key is actually to have data that's presentable according to FDA standards. You have to do
Right.
something called a prospective study, where you register the study and you set it up in such a way that it meets something called good clinical practice guidelines. If that's something that's of real interest,
Remember,
we do this.
I'm a dive shop. I mean, I left, we
So
had
what we need is a nephrologist, an integrated physician that has some background in nephrology to come by and to be willing to sponsor.
I've called multiple and they will not even call me back. I mean, it's just
Well,
really
it's
embarrassing.
really, we need rather than finding a nephrologist that is doing functional medicine, we need to find a functional medicine person that's willing to dip their toes into nephrology. And there are some people that we can.
Dr. Schramm that Josh talks about.
Yes,
all
Dr.
the
Schramm is a
time.
nephrologist, yeah.
I can't, I mean, he's out of Kansas City, so obviously there's a barrier. of
Well,
some kind.
that shouldn't be a problem.
But, I mean, I've asked Josh, so anyway, if anybody out there has
Ultimately-
somebody I can work with, send me a note.
Ultimately, there's, you have to choose your battles here.
Oh, I know.
Choose your battles, right? There's only so many lions that we can hunt.
But there's so many people that are getting benefit out of alternative medicine. They're not
Sure.
going down the mainstream medical path. And I'm only talking about when they've had positive outcomes, they should be able to be reimbursed. If you can put that on paper.
Oh.
That's a
So
big fight.
until we all start asking, it's not gonna happen. But if we all start making that move, now, let me go back and say this. Some of the Christian-based insurance companies are reimbursing for hyperbaric care.
That's good.
You
That's-
should quote the
that's-
Bible verse to them.
Exactly.
You have not because you ask not.
Exactly, exactly, there you go.
Okay.
So, I mean, it is starting to happen, I just want it to happen quicker, because
That's good.
people are
So
suffering.
MediShare,
Yeah, yeah,
That's
is
good.
that one?
I'm trying to be a preferred provider, and they said, well, there's no codes on what you do. And I said, yeah, there never will be, because there's no money in it, believe me, there's no money in it. Mainstream medical, the big pharma is not ever gonna do the studies to make this
No, they're
acceptable,
not.
No.
because it's gonna take them out. And so,
People complaining to their doctors might help.
well, that's what, you know,
And
that's what I'm
informing
asking.
the public.
I would love anybody out there that's headed towards dialysis and you're in the Oklahoma City area, we need to talk because I wanna make that happen.
I think the first stage really is to do a cohort of people and do a small even prospective study and get that data published. It's going to be the first step towards getting some momentum in that direction.
Thanks for your insight. That's why I knew if I brought it up in front of you three, we'd find a way to go forward.
And it's definitely doable.
Mhm.
It's just, it takes a lot of time and energy.
Right.
It's very doable.
So, anybody got something? Do we have any questions yet?
We do.
Do we?
7 more minutes.
Okay, 7 more minutes.
What questions do we have?
We're gonna them out.
Okay.
Bring them off right now.
Okay, there we go.
Speaking of prediabetes that you had, you found out.
Yeah.
And I have it as well. So I'm undergoing infrared light therapy with a pre-diabetes setting.
Interesting.
Yes, and I try to do it several times a week.
What wavelength are you using?
It's, I don't have the formula in my head,
Okay,
but it's specific for me,
interesting.
and it's written by the guy who owns the place, and he's highly educated. He doesn't have formal degrees, but he's highly educated.
Is he out of Oklahoma City?
He's out of Tulsa.
Okay.
And he also designed a protocol for a relative of mine that has hidradenitis suppurativa. Again, another autoimmune type inflammatory disease that's really ugly.
So how severe is this disease?
Severe enough for her at age 16 that it's
Oh my
quite troubling.
Yeah.
So we're waiting to see. I've been checking my sugars since I started this infrared in August the 11th, that's when I started it, and they're all good.
They're good.
Praise God.
Yeah, that's awesome. There's so many alternative, supportive therapies and interventions that we can use for all these different diseases, not just for like pre-diabetes, for cancer, for inflammatory diseases like rheumatoid arthritis, for autoimmune diseases. There are so many things that we can do to improve the health of our bodies. And that's where folks like you, Keith, as clinical nutritionists, you can't do diagnoses, but you definitely are very well versed in different kinds of interventions and different supporting therapies that people can use. And yourself as an integrative physician, right? You have so many different ideas and directions that you can take. You know, I'm not a clinician, I can't give any medical advice, right? So, but my company's in the business of designing different interventions that activate or upregulate or downregulate different biological processes in the bodies based upon the biological activity of different compounds that we have to work with. And so it's my benefit that I get to work with folks like Keith, like you, Dalia, and you guys are the conduits to us of where the needs are and what the compounds are that we can put forward to have a clinical benefit. So that's, go ahead.
Something that I've got, something I've got mic'd up here.
That's right.
So something that I've asked the question is like throwing napalm into the middle of a conversation. I've found because there's so little information about it, peptides. And RFK Jr. mentioned
He did mention it.
hyperbarics, peptides, red light therapy, sunshine, breath work, grounding. I mean,
Healthy things.
you don't hear any of this from mainstream medical. So how many people come in here and meet with Keith and Josh, and nutrition has never been part of the conversation, no matter what path they're on. Nutrition was never discussed. And
You know,
because
because
it's not taught.
a doctor maybe gets 1-2 hours of nutrition training in the context of their whole training, right?
I don't remember any.
So,
But when you've got 7 minutes to go in, meet a patient, hear about their chief complaint, do their review systems, do a physical exam, document it all, you have to do all these things in order to get reimbursed.
and
You
then
don't have
that,
time to talk about,
and then that drives you right down into what is the medication that would help turn the corner.
That's right.
on this? I
that's
mean,
right, it's all about the script,
mhm.
leaving with the script.
Not a nutritional
No,
exercise, but
And who was it that said food, it should be our medicine?
they're just medicine. Oh, there was a,
Hippocrates, was that, you know, that was the whole basis.
Yeah.
Andrew Gruel gave us he's a chef, nationally known chef, and he gave a talk in Tulsa last week on food as medicine.
Oh, that's great.
It was wonderful.
let food be thy medicine is
Yes.
the phrase. But, so anyway, what else we got?
Well, actually, I'd like to know more about your practice, what you're doing now.
Well, I'm working for Catapult Health Systems, which got acquired by Teladoc. So I don't see patients, I supervise nurse practitioners. And they work in employer-based clinics. And then I have done a lot of medical legal work defending doctors at hospitals throughout the years.
Now, when you say medical-based clinics, are you talking about that employer is self-insured and they're trying to manage it at
Yes,
the entry level where,
yes, it's all about preventing chronic or treating chronic illnesses, managing them.
so are they able to use any of the alternative medicines?
Not yet.
Okay, so that's what we've run into. We've had several groups that we've had conversations with that are in major, mainstream medical, and then they got self-insured to reduce their health insurance, right? So to reduce their health insurance, will they still use the platform that's used by the major insurance companies, so they don't have any leeway? They still gotta stay down that path,
They do.
and they can't step outside and use, but now Josh's buddy up in Kansas City is finding a path into that. He's using your all's products, for instance, that's what he's prescribing, so.
I think we have some great questions here.
So yes, we have a little bit of time for a few questions, and we'll share this a little bit, but let's see. Taking Fen-Phen and ivermectin kidney tests is way above normal. Should you pause the treatment for a week and then start again? So, and just a reminder, so, you are not a patient, client of ours, so we can't give specific recommendations, but so typically, if anything, these have more of an issue with more like a liver type, issue, the liver enzymes going up with these and or with other medications and herbs, although there's still a possibility, but probably decreasing the dose, talking to your practitioner, and assessing that, making a change and repeat the assessment to figure out what to do. But it could be a mixture of things. So we have been talking about kidneys to a certain extent, but there's other issues that can contribute to kidney disease, and like the creatinine going up or the GFR going down. So there's a possibility, but there's probably some other underlying issues actually going on. I can't say I've really seen that happen with ivermectin or Fen-Phen. Also a question about red light therapy at home devices, which are the best with real infrared light therapy bulbs and low EMF. So we do have some other actually podcasts or sessions available. It's actually been recorded, but going into that, but a near infrared actually needs to be more like close to 1,000 or higher nanometers to get that penetration in through the skin and literally through bones in cases. And so a red light that's more like 600 penetrates barely through the skin.
It's good for skin.
It's good for
problems.
skin issues, yes. But to get that penetration requires both over 1,000 nanometers and also close approximation. We're talking about inches away from the skin to deliver enough energy to the skin.
Well, there are some that actually wrap around a joint, so they're on the skin.
Around the joint, helmets, that are just right there.
But when you get into that, the biggest thing is don't get on Amazon and buy the cheapest thing, because there's a lot of stuff that's not made in the US. And even though it says that it's in these wavelengths, it's not. And then when you go into the EMF, the radiation that's coming off of it, it's not posted properly. So there's all these things that, why would we stand in front of something that's giving off all this EMF and we're trying to be healthy?
And there's some information at hyperbaric.plus. There's a resource tab with information about the platinum.
Yeah. Platinum LEDs, what we landed on, but there's a lot of videos in our resource page that takes you to all the experts to learn how to pick out the right LED light.
So yes, so that's a very good question, and great that you're asking that and not just assuming because it's a red light that's going to work.
Right.
One of the things I talk about is, the red light, when they talk about how much energy, joules, that are landing on per centimeter square,
Yes,
okay, because you want to distribute that evenly.
yes.
I always bring up the fact that football stadiums, people don't realize that each of those lights in a football stadium are pointed to a spot on the ground. They think it's just ambient light, but no, each of those lights is focused in a grid to light up that part of the field. And that's the same way that a red light panel should work. It should distribute that energy evenly across the body, and they rate that per centimeter square, how much energy lands on each per centimeter square. So really, there's a lot to it. Don't buy the cheapest one.
That's right. Yes, that's correct. So that was one of the questions. So part of that question was about how that price. And so yes, you do have to get a good one. That's correct. And it does take some research on that. And so here's a question. So what are some of the inflammation biomarkers I can ask my doctor to test me on?
Well, the main one is the high sensitivity CRP.
HSCRP.
Yes,
C-reactive protein.
C-reactive protein. And other older ones are sedimentation rate, things like that, protein levels. But you was talking about the micro,
Talk about the monocytes, monocytes and neutrophils being elevated is another sign. That's another sign of actually where I'm trying to evaluate natural killer cell type activity that fights cancer. And so if the monocytes are elevated or higher, and then the neutrophils are higher than lymphocytes, that's setting up an environment of an inflammation environment environment inside the body that weakens neutrophils and weakens the lymphocytes and natural killer cells. So anyway, that's just another way to look at that. But yes, HSCRP. So I have a lot of clients that do get that test, and so it's a great way to look at that. And can you suggest the best at-home infrared therapy device? There's many different ones available. Check out hyperbaric.plus for more information. And I have lots of inflammation, rheumatoid arthritis, and I've been on the Xanomega. How can we tell if it's helping? So sometimes we have to, and I shared this story yesterday, sometimes we have to take things, test, assess, and see if it's working. Sometimes it's subjective or how you feel, and then not take it. Assess again and see if those inflammation markers are going up and or how you feel. And so I've done that, and I've taken and not taken curcumin products, and I could tell the difference taking the UltraCur Plus a significant difference. When I got off of it, it's like, I really do need that surgery. I really do need it. And
You know how many clients have come in here because of inflammation and we start having conversation and rheumatoid arthritis comes up and I'm like, have you ever been tested for Lyme?
yeah, there's
Oh.
exactly,
They
there's all
used to
kinds of
call
things.
it Lyme arthritis.
Mhm.
And so then, so they know and then they go do a Lyme test, which are expensive.
Right, yeah.
You know, the entry level is a $500 test and the more complete test is $1,000. But man, if you're dealing with Lyme, you got to identify that. There are ways to attack it. But, and we're getting ready to start a little study in here, as Josh has, I'm sure, shared with you. But, man, it's so important. People with MS, people with rheumatoid arthritis, I can't tell you how many of my clients that turned into Lyme. And when they started addressing it with a Lyme protocol, things got better.
Yes, so there's many different causes of inflammation.
Right,
You
right.
know, so it's not just one thing.
Right.
So
But by the time they get here, they've already done 19 things with their doctor. Lyme doesn't exist in Oklahoma.
A lot of times you'll have an inflammatory process going on and a lot of people just don't know what the cause of it is. And it's so important to get an assessment to find out really what's driving the inflammatory process, because if you don't deal with the root causes, you're just going to be treating the symptoms for a long period of time. Just like Keith with with what was going on with the joint in your hips, you were able to put off surgery by using curcumin, which powerfully drove down the inflammatory process, but you had bone on bone,
yes,
beyond bone on bone.
Yeah.
The bone was grinding into bone.
that's right.
Yeah, and so it was. It's important to get down into causes and conditions, and really a good functional doctor or even yourself as a clinical nutritionist can help get people to a better place.
Is that it? You got another one?
One more question, but also it's going to be a repeat. I don't know if it's by the same person or not, but Fenbid and ivermectin, a monthly test, which I do recommend, frequent tests, you know, to evaluate, you know, the liver enzymes, do the metabolic blood test. But in this case, the kidney portion went very high in the chart, should have paused treatment for 1 week or so. But yeah, once again, make a change, you know, work with a practitioner and reassess that. And so evaluating that dose and other underlying issues. So there's other things like blood sugar and circulation issues, the most common causes of kidney disease.
So a lot of the practitioners are unaware of the patients taking these drugs.
Oh, really?
Yes,
Why are they afraid?
No, they're not.
because it's not standard protocol
That's
that
right.
they're told about from their organizations, the higher ups. So there are places where you can get labs done on your own. I know in Tulsa, you can order it yourself, you have to pay out of pocket. Are there such places in the city?
Yes, actually, most states, you can actually get a blood test without a doctor's order. And New York is, and maybe, actually, I think New York is maybe the only one. I think Connecticut, I know some clients are trying to go from New York to Connecticut to get their blood tests. And so you can actually get a blood test without a doctor's order in most states, including throughout Oklahoma. And you just have to, well, you can go to the lab and let them know, and they actually pull out a different price sheet. You know, here's the insurance price sheet, and here's the cash pay. You let them know, and then it actually is not even part of the medical system, and it's not on your medical records. So I have some clients that are doing that because they don't want their doctors to know, because they're afraid the doctor's going to fire them. And so, but it's very important to follow up with that. The metabolic blood test is like $19 plus a lab draw fee, so it's less than $30 to get a blood test. So actually, but now not all labs will do that. It may be a lab policy too. So some labs may not do that without a doctor's order, but it's according to state laws, anybody in Oklahoma can get a blood test.
I think most LabCorp and most
LabCorp
Quest will honor DLO.
Yes, that's
will
right.
Will honor walk-in.
On my website, Prevail Over Cancer, I have a resource page. I've got a link for things like that too, where you can go to get lab tests. And I have a lot of clients that do that. So, yes.
So, here I am trying to grab the mic. So anyway, as we wrap this up, it was really interesting. We had somebody that as like a level 1, grade 1, PSA was elevated. And so, not gonna do anything for 6 months. What a perfect situation to get monthly labs and start doing things outside the medical that don't even go down that road. Let's see if you can change that trajectory just by educating yourself and getting some people to help you down that road.
That's right.
And as an eye opener, I think, in that conversation, that maybe we can turn this thing around where I don't go back
Exactly.
and have to deal with it.
Have to change that internal environment or terrain inside the body that allowed that to happen.
God's made our body to fix itself.
Yes.
If we do the right thing.
If we do the right things, exactly. So we have to evaluate those things and make the changes instead of doing the, 6-month wait and see.
No, I don't think so.
Yeah, that's right.
It's not in my playbook.
The PSA will continue to go up. And so we have to address those underlying issues. And there could be, literally, there may be half a dozen things that are contributing to it.
Sure.
And so the more changes that we can make, the better the results are going to be.
A lot of times they're doing the wait and sees because that's all that insurance will pay for, right? That's not necessarily in the interest of the patient.
Yeah, so that grade was low enough at a 1A or something like that, that's right, the no insurance companies are gonna do anything with that. So that's not part of that protocol.
Right, that's not a rational choice for somebody. I don't think it's a good choice.
Well,
Okay.
we're gonna stop there. Dalia, thank you so much for coming in. I'm glad to know you, and I'm really looking forward to how we can work together. You're up in Tulsa, and you're actually working, what was the company you're working with?
Well, my company is Restore More.
Restore
I
More,
work
okay, good, good.
self-employed.
So that's an awesome, another part of it. All I try to do is circle myself with people that are in the business, that they can look outside the box. They have the ability to look outside the box.
Make connections.
I'll be looking for a functional nephrologist.
Well, good. I mean, that's what we
need that.
need to find one.
We need to.
Because you even mentioned kidney issues.
Oh, yes, and I do have a friend who has put off dialysis for 30 years by doing diet and exercise and red light therapy, and she's been in the hyperbaric at Jenks.
Good. So Revolution, you know Kevin Hiddlebrink?
I don't know.
So
Sorry.
he's there in Jenks, and I've known him for a long time. Good guy.
Good.
Hey, Revolution Hyperbarics. Well, hey, thank you all for being here again for another one of our sessions. Thanks, Adam, for coming from Ultra Botanica. And Dalia, what a pleasure to meet you and get to talk to some other people that are in your world. And Keith, as always, prevailovercancer.com, a great resource. If you get one of those crazy, you're headed down that path, you need to talk to Keith early on and find out how you can test, assess,
Don't guess.
don't guess.
Mhm.
Don't guess, assess,
Assess.
whatever. But anyway, great topic. I appreciate everybody being here. We will be back next week.
Yes.
No telling what we'll be
That's right,
talking
who knows?
about. So come back and see us.
Glad you
I'm
just-
Paul with Hyperbaric. Hyperbaric.plus. We'll see you a little later.